Welcome to The Explainer. Today, we are diving deep into a fundamental nursing skill that, let's be honest, is often overlooked, but is absolutely critical for patient assessment and safety. We're talking about essential foot care. And trust me, you'll be surprised what you can learn just by looking at someone's feet.
All right, let's get right into it. Here's our game plan. We're going to walk through this skill from start to finish. I'll be framing everything within that nursing process you already know, which should really help it all click into place.
So, first things first, let's really get a handle on the why behind this skill, because I'm telling you, it is so much more than just cleaning. It's this incredible opportunity for assessment and prevention that you really don't want to miss. I want you to think about this for a second. A patient's feet, they can be a total window into their circulatory and neurological health. Are they getting enough blood flow all the way down there? Can they actually feel their toes? This isn't just about hygiene. It's about seeing the whole clinical picture. So look at this. Every single time you perform foot care, you are doing way more than just washing. You're basically a detective looking for wounds. You're a vital signs machine, checking those pedal pulses. You're a protector, preventing nasty infections. And just as important, you're a trusted caregiver, building a real relationship with your patient.
Okay, let's shift gears and talk about the pre-procedure checklist. Because, as you know, great, safe care, it always starts before you even lay a hand on the patient.
These initial steps are your absolute foundation, right? Reviewing the chart, that prevents errors. Grabbing all your supplies at once makes you efficient. Providing privacy shows respect. And explaining what you're doing, well, that helps calm your patient down and builds that essential trust we just talked about.
And before we go any further, let's just hit pause. I want to focus on the absolute non-negotiable safety checks that you have to perform every single time.
These 3 checks, think of them as your safety net. Hand hygiene stops the spread of germs, plain and simple. Using 2 identifiers makes sure you've got the right patient. And that final verbal check for allergies, that can literally prevent a life-threatening reaction. Whatever you do not skip these steps.
All right, with all our prep and our safety checks totally complete, we are ready for the hands-on part of the skill. Let's get into the procedure itself.
And remember, we're always using standard precautions. For this procedure, that means at a bare minimum, you're wearing non-sterile gloves. Now, if you think you might splash or come into contact with blood or other body fluids, you're going to have to add more PPE.
So here, we're doing 2 things at once. We're combining good ergonomics for you with a really thorough clinical assessment for them. Raising the bed saves your back. Seriously, do it. And while you're there, you're inspecting the skin and you're checking for those key pulses to see how their circulation is doing.
The thinking here is simple, but it is absolutely vital. Warm water, not hot, okay? That's for comfort and safety. You wash to get rid of any dirt and germs, and then you dry completely, especially between those toes, to remove any excess moisture that could lead to skin breakdown or an infection.
And this is a huge safety point. Moisturizer is great for dry, cracked skin on the feet, for sure. But if you leave a glob of it between the toes, you're basically creating this perfect, warm, damp environment for a fungal infection to grow. So always avoid that area. So the skill isn't done just because the feet are clean. Nope, now we've got to clean up our environment and, most importantly, make sure the patient is left in a totally safe state.
This final checklist, this is your last line of defense against falls and injuries. Lower and lock the bed, make sure that call light is right where they can grab it, and get those non-slip socks on. You're setting your patient up for safety long after you've walked out of the room.
And now for the final, and I mean crucial phase of the nursing process, documentation. Because you've probably heard this a million times, but in healthcare, if you didn't chart it, well, it didn't happen.
Your documentation really needs to be a clear, accurate snapshot of what you did and what you found. This is what allows the entire healthcare team to see your important assessment findings, and it makes sure that your patient gets that excellent, continuous care they deserve.
And please, remember this. Your assessment is critical. If you find a new wound, or you can't feel a pulse that was there before, or anything else that seems off, you've got to report it to the provider right away. Your sharp eyes can lead to early intervention and way better patient outcomes. So, as we wrap this up, just remember that foot care is so much more than a simple task. It's a powerful assessment tool. It's an opportunity to build trust and prevent serious problems. The next time you're doing foot care, remember, you're not just washing feet. You're providing comprehensive, compassionate nursing care. And that leads me to a final thought for you to take into your clinical practice.
Mastering these fundamental skills is absolutely key to your success, both as a student and as a future nurse. So, if this explainer helped you out, please take a quick second to like, share, and subscribe. We've got a lot more nursing content just like this coming your way.
Oh, and one last thing. If you happen to be studying for your boards, you are definitely going to want to check out the links in the description below. We've put together some awesome summarized NCLEX revision guides that cover all the core nursing courses. Thanks so much for watching.